To you and to our SABC viewers at home, we're here at the Chris Hani Baragwanath Hospital. You will remember that on the 25th of December, we were at the Tembisa Hospital with the MEC of Health in this province. That would be Nomantu, Nkomo-Ralehoko, talking to mothers, engaging them. They were so happy, and now she has moved to Chris Hani Baragwanath Hospital. We were told that 13 bouncing babies were delivered today, but let me engage her. She is emotional today, and I don't know why. Happy New Year, MEC. I see your eyes are teary. You're overjoyed.
They are tearing indeed. These are tears of joy, because I always say to the team, sometimes dreams do come true. I always give them some of the ideas that I want us to do. This is part of my ideas that I said we must have a ward that is like this one, a ward that will give parents a joy when they have their children. Because even if your child is not well, the child is at the critical care. But the environment, if that critical care is like this, you definitely feel good to yourself. So this is what I wanted, and I'm happy about it, and I'm excited about these little babies that we have welcomed. Even here, you will see them. This ward is going to be occupied. But today, because we have many people, we said they must not bring them because we're opening it. But immediately after this, the team now will start decanting some of the children that are on the other side. But this is 18-bedded ICU ward for neonates, which I'm excited about it. Besides that, we have the 12 on the other side. So we'll be having 30 now ICU beds for the neonates at Chris Hani Baragwanath Hospital. We have seen the design itself, the equipment that you can see, the high-tech equipment that we have done to this world, we've installed. And again, we're going to install some cameras so that when the nurses are there, it's able for them to monitor those children just sitting at the workstations right at the door, next to the door there with the security. So I really feel that my team has overdone in terms of producing this ward. And you have seen again the ward that we opened in Tembisa. That was a beautiful ward again. Now I said to them, every 25th and every 1st, I don't want to go and just give children birth certificates and presents. I want to see something that is associated with neonatals. And we formed a team that is led by Professor Velapi. He's taking rounds, bringing other professors in other hospitals and other heads of units, so that when they must always have monthly discussions about how can we make sure that we save our young ones, they don't die. And I think you've seen even the death rate now has reduced in the hospitals. It's because of the commitment that we're doing and the monitoring that I'm doing myself and the support from those teams.
You can clarify for us, 13 babies were born. You can give us the gender, and how are you feeling about it? You engage their mothers. What are they saying to you?
Pity that I'm being now interviewed by a guy and I'm biased towards girls. I have 9 boys, and anyway, I'm wearing blue, you can see. I think I predicted this, that they will have more boys today. In Tembisa, at least it was 50-50. Out of that 12, it was 6 boys and 6 girls. Here, it's 9 boys and 4 girls. But I'm excited about it. They're all beautiful, as you have seen them. They are all healthy. Their mothers are happy, and the mothers are healthy too.
Let's talk about the incident that we hear that happened at Westberry. Mother and child died while giving birth yesterday. Your reactions?
My condolences first to the family that they have lost their loved one in our hands, because it was at Westberry Clinic where this incident happened. But again, we are still busy investigating so that we are able to come out then and clarify the citizens about that incident. But I'm really, really feeling sorry for that family, because I know it's not nice to lose a family member.
We also heard about twins being poisoned in Tembisa. Do you know anything about that?
I've not received any report about that. I'm still going to investigate. I've asked my team to make a follow-up about that.
Your message now to people in South Africa, residents, most of them, they do complain about government hospitals. And now it seems as if a wheel has turned.
we're changing it. I want to tell the South Africans they must have confidence on us. It depends on the commitment of the team that you have. It depends on the deployment of people that are in these institutions. And I think I want to say maybe the Premier deployed the right person now that is able to monitor and assist those that needs to make sure that this is implemented. The clinicians and those that are working in the infrastructure teams are working 24/7. Akuphunyulwa kwa health into enokuxelela yona kuyasetyenzwa ngoku.